I would ask them about their skincare routine. If there's someone who's really consistent about it, I actually celebrate it because I try to tell them that is part of your confidence. Confidence is made through the actions. Confidence is not easily achieved with just one day or one thing.
Hello, everybody. Good morning, good afternoon, good night, wherever you may be tuning in from. This is my podcast. We call it the Empower the Patient. And this is a series highlighting the accomplishments, attitudes of changemakers advancing women's health and empowerment across Los Angeles and now Orange County, too. Today, we are talking about aging, autonomy, and the power dynamic in aesthetic care. I have Thaomy Nguyen. She's actually a dermatology registered nurse, and she is actually going to be talking more about educating women on healthy lifestyle choices and customizing their skincare regimens as she monitors their progress of her patients as they build confidence, restoring their skin health, and taking ownership of making wellness choices that affect their long-term health as well. And she is actually going to be pursuing a family nurse practitioner program at West Coast University, where she also earned her nursing degree. And she is currently a nurse consultant at a medical spa in Newport Beach called MeSo, and she specializes in skincare and injectables. She's also worked as a wound care nurse at Newport Hospice as well. So please follow her Instagram. It is at mature.skin. Super easy to memorize and super excited to have her here. She is actually our first registered nurse ever that has had a conversation with us. And so, just going into the first question, this is going to be like a little bit of a longer one, but just to set up the context of the question, many women come into aesthetic spaces, maybe holding some insecurity shaped by social pressure or past dismissal in healthcare. And so, how do you help your patients reclaim that confidence rather than feeling pushed towards like a specific look they need to follow?
Happy that you've asked this question, especially when it is very subjective. What I mean by that is understanding what brings you confidence. One person can say, my hobbies give me confidence. Another person can say that my faith gives me confidence.
Hmm.
So whenever I get patients who are essentially coming for to get consulted with me, with that, I try to understand what their lifestyle is and highlight the good parts of their lifestyle. So
Hmm.
what I mean by that is, for example, I would ask them about their skincare routine. If there's someone who's really consistent about it, I actually celebrate it because I try to tell them that is part of your confidence, that you're confident enough within your own skin that you are participating in the acts of self-care, which is the consistency of the skincare that they have. Um, Another thing, when it comes to looking for that specific look, I hate trends that goes on when it comes to what you see on social media. Um, Unfortunately, I've been seeing a wave of patients who are at the age around 18 to 24, and it definitely breaks my heart whenever they come to me and say, oh, this is the type of look that I want. For example, the fox eye look that you can achieve with Botox or the dolled eye look. But essentially, they don't understand that those looks are based on the unique features of that ethnic group. For example, us Asians, we are tend to have more of that fox eye look because of how almond shaped our eyes are. However, more Caucasian people, they have more dot-eyed looks because of how round our eyes are. But it's unrealistic how I would have a um, Caucasian patient wanting that fox eye look, trying to achieve it with Botox. And this is where I would want to say, hold up, let's go ahead and highlight what is beautiful about you. And I would have them look in the mirror and say, what stands out to you the most in terms of, what you love. Most of them would say my eyes, how my cheeks stand, and I would highlight and say those are your features that you were born with to start with. So therefore, when you are looking for confidence, I want them to highlight the confidence of what they can do every day and within their control, because confidence is made through the actions, and confidence is not easily achieved with just one day or one thing.
I actually really like how you overlook like more of that profitability aspect. Like I know you can get commission from, let's say, like the more treatments that a patient does stack on, but you really like put more emphasis on, I guess, like highlighting what they already have with their natural look, as opposed to saying, oh, you can do XYZ and do more to change that natural look. So I actually really like that approach that you take, as opposed to some other people, I guess, that in medical spas they want to make as much money as possible, or they want to seek as many treatments just so that they could get more money from clients. But I think that is a very really, really good approach. And so this actually leads into my next question, just building more on patient confidence in general. So, how does patient education, specifically about the anatomy of your face, you're talking about the doll-eyed look or the fox-eyed look in different like racial ethnicities for different patients. And so when you educate patients on their anatomy, aging, and realistic outcomes, how does that tend to change the power dynamic between you as a provider and then the patient? Oh, and also you are muted. Yes. Awesome.
When it comes to educating patient about their anatomy and realistic expectations,
Hmm.
like I said, beauty is the eye of the beholder. It's very subjective. So therefore, whenever I get patients talking about what they want to achieve, I first want to highlight what they like and what they don't like. Now, the time when I would step in and say, whoa, this is not the treatment plan that I wanted to go. Let's go ahead and go a different path. And that's just because there is a clash between their wants and their true anatomy. What I mean by that is I would have a lot of patients saying, hey, my smile lines are something that's bothering me. This is the first thing to go. But without their understanding that the reason why patients get deep folds is because of the last loss of fat pads around their lateral region. So for example, their temples and their cheeks, of course, you're gonna always gonna have that fat there ever since you were born with. But as you become wiser onto this earth, those fat pads melt away through natural, decomposition and such. So with that, it causes the skin to pull inwards and downwards. This is what the expectation of aging would look like. So the folds that patients come in wanting to get filled is mainly a symptom, and the loss of the fat is the cause. So with the cause of the loss of the fat results in the symptom, which is the deepening of the nasolabial folds. Now, because patients, of course, are not educated in that, they don't understand that there's options to fill in the temples, the cheeks first, and then filling in the nasolabial folds. Without true education and understanding of that anatomy, patients can just easily fill the folds without the support of the temples and cheeks. Eventually, they're going to have heaviness on the center portion, and it's going to make them look older than younger with that mistake of not understanding true anatomy. And also, if you look onto the side and you fill in these folds, it's
Hmm.
gonna make you look like a monkey from the side. So this is what I mean.
Mm.
So from natural position and from the side, if I do filler, it's gonna look this heavy. It causes like you kind of look like a monkey from the side because there's heaviness here, but without the balance from the side area. Another thing in terms of patient education, anatomy, and realistic outcomes is when patients come in for Botox.
Mhm.
I understand with the price of Botox, it can be quite hefty. So patients tend to, I hate to say the word, but bargain with me just so that they can get the right pricing with what they want to get. So, for example, patients would say, hey, I have forehead lines. They come more, horizontally. I want to get rid of them. But this is the only area that I want to do. But they don't understand, um, and through the help of my education of anatomy, that I need to tell them you need to get also units in the center portion, which is called the 11s. The reason why is because Botox does the opposite of what the muscle does. So with your 11s, if you do it with me, you do the angry face, so it goes downwards.
Mhm.
Well, the normal motion is that it goes downwards. So whenever I do Botox on this area, it goes upwards naturally, opening up my eyes. Now, The forehead area, naturally, it goes upwards,
Hmm.
causing the horizontal lines. So therefore, if I were to put Botox here, it will go downwards. Now, without the support of here, um, my patients are going to feel this heaviness like this, like my eyebrows down. Without the support of here, you're going to feel that. So if I add support, now it balances. That's why I would always tell patients about anatomy, why it works and why the pricings are like this and why you should go with the certain type of treatment plan. And I truly believe that that is um, the job of the provider in addition to the job of the patient because I always tell my patients that you are your biggest advocate at the end of the day. So,
Hmm.
with that being said, it's always great for you to ask the provider everything that comes to mind because you are going home with these results. You are going to experience it every day. So, therefore, it's always important. Ask the patient. I always tell them, ask the most silliest questions, ask the most hardest questions, because if your provider cannot answer those questions, that means that provider is definitely not for you. And it's always a team work between provider and patient to reach their goals.
I was also going to ask too, I'm sure you've had some instances where like the units of Botox don't imagine what they have, that number that they envision in their head because I feel like that's what I mean by power dynamic too. Like sometimes patients feel like they know their face anatomy well enough that they can't fully agree with you sometimes. I guess like how do you go about those like more stubborn patients that don't really see why they need more units in the 11s, for example, when the forehead naturally is supposed to go up, as opposed to down if you were to just fill on the horizontal lines here.
Absolutely. So it all starts with setting up that realistic expectation. I always end the conversation with, hey, this is your face that you are that you're going home with. And as long as I did my part in providing you the education, it is up to you to make that decision
Mm,
because at the end of the day, these procedures are not in an emergency situation. It's a little bit different than your traditional hospital because it's more black and white. It's like, I need to save your life or not.
right.
Whereas for aesthetics, it's more of subjective, it's more of how the patient feels. And I feel like that's why I would say being an aesthetic field is more psychology in addition to science,
Mm.
as of helping the person set a right mindset when it comes to how they want their face to look like or their health to be. Um, and at the same time, I always offer them to come back for 2 weeks. I always offer my availability because at the end of the day, I'm always going to dose conservatively and offer a follow-up because it's always easier to add on than to take away.
Mm.
I can suggest you 16 units, but if you want to go down to 12 units, I can still honor that. But as long as I educate you and I tell you, this is the expectations of the 12 units, you can take it or leave it, but my doors are always open if you do want um, fixing or if you want different types of results.
Snaps to that. That's great. I really like that quote. I'm actually going to highlight that for sure. It's better to add more than to take away because to take away means that you're acknowledging something that was too much originally. So I very much agree with that too. And so that actually integrates into my question about culture. So you mentioned in social media that in this culture that often treats aging almost as something to fix now. How do you encourage patients to define their beauty in their own terms as opposed to these cultural references, especially for women that you treat that are in their midlife or later stages? Of self-identity. So, for example, I guess like especially more women with wrinkles.
Absolutely. So when it comes to treating the demographic of mainly mothers, which is a middle-aged woman, I tend to feel how their lifestyle is.
Hmm.
building rapport and empathize with them based on what they're struggling with because it's easier said than done to say, you can go ahead and do your skincare every day, sunscreen every day, have like four products to use consistently, but they don't understand the patient's lifestyle. Like sometimes mothers, they don't have their own time to do those things, or busy bosses or a disability that, creates them like that, or certain medications that make their skin like that.
Mhm.
So with me trying to encourage them to define their own beauty in their own terms, is I want to have them highlight what they can do in their own control already. So what I always tell my patients is when we're aging, it's not about the wrinkles or the saggy skin, but it's more about what you can do within your control, like your everyday skincare, who you are as a person, your type of eating habits, your lifestyle. Yes, treatments here and there, they're great, but nothing beats your consistency and commitment of daily life. What I mean by daily life, I'm not trying to tell you to like be proactive every day or and such like that, but just being able to live true to yourself in order to achieve what you want. So I'm just going to use my reference as an example because no one knows yourself better than yourself. And I feel like the things that I went through can resonate with a lot of my patients. So I am an immigrant. I moved here when I was about 10 years old and almost entering teenage years. And I was between a culture clash of Eastern beauty and Western beauty.
Mm.
I didn't understand, and I didn't see where I could fit in when it comes to looking good. I followed the trends of what was popular, so it was more of Western trends, that really archy eyebrow and that eyeliner. But with us Asians, when we open the eyes, it's like one straight line. So
Yep. So true.
with
Yeah.
with through like the trial and error of it all,
Hmm.
I soon to realize that, hey, let's just go ahead and highlight the features and what I really like.
Mm.
And with that, I understand more of like my culture, and that's where I defined beauty, which is beauty within my own culture, which is like the Vietnamese community.
Hmm.
In addition to that, I always want to take away the status quo of what true beauty is. Like, there's no such thing as one shape of eyebrow. There's no such thing as like one shape of lips. Um, Also, in addition to what I've experienced to define my own beauty, I thought beauty was more superficial
Hmm.
of look,
Hmm.
but I neglected what was inside. And with what's inside is what I feel like when you feel good, you look good.
Yeah.
So trying to feel good terms of journaling, um, finding your faith in who you are and how you can create that is through the habits, like I said. Eating great every day, consistency of skincare. And through that, I was able to be more comfortable and have that high self-esteem. And
Mm.
when I have that high self-esteem, I don't fall into beauty trends easily.
Hmm.
And that's where I was able to find my own self-identity.
I see. I think that's a very good cycle that you described too. I like how you said that beauty is something that isn't as superficial as what you see on your face or your body. That's actually like one of the first times I've heard of beauty as defined as like what you feel internally too. I think I do agree with you. I think your mindset and your mental health goes hand in hand with how you present yourself too. And so I could see like why it could be redefined as more of like how you exactly like what faith you follow, for example, what is healthy to you, like what foods you consume, how much sleep you get, like your social circles in your life too. I feel like that goes very much hand in hand with beauty. Would you say that could you repeat what you said earlier about what you have internally kind of translates to how you define beauty on your own terms? I really liked what you said.
Oh yeah, 100%. So, um, how do I say this? Confidence is built through habits,
Mm-hmm.
Whether that's the very small things like making your bed, because it's the small wins. The
Mm-hmm.
more small wins that you gain throughout your day or throughout your lifetime, that's the small confidence that you've gained within yourself.
Mm.
And as you build more confidence, like for example, my confidence in my skincare routine,
Mm-hmm.
I identify myself as a very lazy person. So whenever I'm a lazy person, I want to be as effective so I can be consistent.
Mm.
That relates to my skincare routine. My skincare routine is only 3 steps, morning and nighttime, so that I can be consistent with it. So with that consistency, it makes me build more confident because I can check that off my list.
I see.
So the more little things that you can check off your list, your brain sends in that type of dopamine, and that's the confidence that you've built from within.
That's what you mean by aesthetics is also psychology too and science. Yes, everything is tying together so
Yeah.
well.
It's kind of
Um,
like you know the book Atomic Habits, where you say you're putting 1% every day.
yes. Yes, compounded. Yes.
Absolutely.
Like
So
you're right. Yeah.
100%, the Atomic Habits where you do 1% every day, it doesn't have to be the full 100% because you're going to burn yourself out. But I use that quote a lot for my patients who are in their midlife, especially mothers who just gave birth,
Mm-hmm.
mothers whose kids are out of the nest. Because they would say, oh my God, I look at myself in the mirror and then like I just don't know who this is.
Mm-hmm.
I forgot who I am. And I would tell them, give yourself some grace. You've built a family or you've gone through pregnancy. That is traumatic at itself. And at the same time, you've put your priorities first, which is totally valid. And the priorities are your kids and your family. So
Mm-hmm.
now you're taking back your life, and it's not a crisis. It's more of a rebirth, is what I tell my patients. You're not having a midlife crisis, you're having a rebirth of a new life that you're entering in. And be excited. Your kids are out of the nest. Or another thing, hey, be excited. You just gave birth. 1 year of having this newborn being survived. What I mean by 1 year is that they have to breastfeed and they can't really get treatment. So, but after a year, they come and see me and they're like, I can finally have myself back. So it's all about empowering yourself as a mom, as an aunt, as a, whoever your new role you're stepping into, whatever role you're stepping into. And that's why another thing that I would say empowerment is through small habits and small wins that leads to big ones. Because if you keep working on and to check off a big win, it's gonna feel exhausting.
That's true. That is very true.
Like what sounds more attainable and more appealing? Getting rid of wrinkles or being able to clean your skin every day.
That is so true.
Right?
Yes, that makes a lot of sense. I really liked how you break it down, and I really like your philosophy. I could see why your patients, clients always come back to you. And so I just wanted to say this is probably one of the best conversations we've had so far because you really touched all the bases about different patient populations, especially female populations with like new moms, older moms, and then women who want to address like bigger issues like wrinkles, but um, really emphasizing that it's more important to make those attainable, smaller wins as opposed to something big that can go into like really having like an idea of what beauty is on their own terms as opposed to what culture says for them. So thank you so much for your insight. And this was so much fun to talk about. This is the first time we talked about aesthetic care. So thank you so much for being the first person to really address these issues, and really knowing how to frame your mindset to really redefine what confidence means for female patients. So thank you so much. And that is pretty much it. So like I said earlier, you can follow Thaomy at mature.skin. She posts very consistently. And this has been the fourth episode on Empower the Patient, where we feature the accomplishments, attitudes, and change makers of women who advance women's health and empowerment across OC and LA. So thank you also for being the first OC representative as well. So thank you so much, and that is it. We'll see you next time.